Hello everyone, I'm Tobias Czempiel from the Technical University in Munich, and I want to present our work, Surgical Workflow Recognition, from analysis of challenges to architectural study. So when talking about surgical workflow recognition, we usually think about the internal endoscopic videos, such as in the colic 80 dataset, but also the external surgical room videos can be considered for the surgical workflow recognition tasks, which is what we also want to consider in our study. For the automatic prediction of the surgical workflow for each time step, there are different configurations on architectural choices one has to think about. So frame level methods only take into consideration a single time step for the prediction of the current surgical phase, while clip level methods use multiple frames, basically the local temporal context for the prediction. Additionally, one can extend these architectures with a second temporal stage to better reason about the long temporal correspondences for surgical workflow recognition. Finally, different model types can be used for the different architectural choices. In the following, I want to give you an overview about the limitations of these architectural choices for surgical workflow recognition. So descriptive frames should be easy to classify for all of the above mentioned architectural choices. However, when we encounter local ambiguities such as smoke in the image or occlusions of the cameras, one single time step in our image level methods might not be sufficient, and an additional temporal context, local or global, might be useful. Global ambiguities are frames that can appear in multiple phases, and it's really important for these ambiguities to have a longer temporal context to take into consideration for a successful prediction. So after this analysis, we wanted to see if our hypotheses about the different configurations aligns with our experiments. And firstly, we see that indeed, the small temporal context of clip level methods can improve the results of a purely frame level prediction. However, when adding a stage 2 temporal model to the pipeline, the clip level advantages can disappear and might even be detrimental for the results when using smaller datasets such as colic 80. For the larger external datasets, we see that stage 2 architectures outperform the stage 1 methods, and the combination of a clip level with a stage 2 temporal model results in the best performance overall. So this result actually aligns with our initial analysis, and we could show this effect over different model architectures in stage 1 and in stage 2. In conclusion, we expect that the bigger datasets will help to overcome the limitations of clip level methods, and we will expect to see more in the future. Overall, in our experiments, we saw that TCNs show marginally improvements compared to LSTMs, and that the architectures for the internal and external scenarios are translatable to each other. Thank you for your attention.